show, only on Sleek Television. Every second that the society they make headline and they issue them, kintinap now we aid, even for clear them kintikanga.
In Sierra Leone, a new drug is turning young people into zombies.
So it's important for broke down the issue today, for let the public understand.
Now that's make we bring come to you the Today Show. We get segments where they range from interviews on the big issues.
Sierra Leone authorities said Monday that 20 people were killed and nearly 2,000 prisoners escaped during Sunday's attack on the capital.
To sport.
What a fairy tale story here. There they are, the champions of Africa.
And entertainment and simple tourism with plenty other issues.
Get ready for the roller coaster ride through with day-to-day story them as we dive deep into the heart of the matter.
Every weekday on Sleek.
It's a beautiful Wednesday and the midday of the week, and I want to say Women Crush Wednesday to all beautiful ladies out there, especially to Sleek TV viewers.
Many a times, you know, the guys that out there or the man they out there don't they fail for tell the woman they say WCW or Women Crush Wednesday, but on behalf of them, we want to say WCW, Women Crush Wednesday.
Wednesdays are for ladies. Well, I also want to take welcome you to the show here on Sleek Television, channel 37. You can also join me on with Sleek TV, on with Facebook at Sleek TV, website at sleektv.com, and follow us on all social media handles. Rabiatu Mansaye.
John M. Abdullah, we will take a quote for today's show. Rising cases of HIV, hepatitis, and syphilis remind us that health is the foundation of a strong nation. By raising awareness, providing care, and standing together, we can turn the tide and build a healthier, brighter future for Sierra Leone.
In that regard, I make we ask the question, why and what will be the impact? As recent studies don't show say there is a rise in case in both HIV and hepatitis, with 1.7 at HIV and 13% for hepatitis in the country. Stay tuned for more.
Man them. This na boys. Usai man and they put all thing at table from Pantap to Godo. Inside boys, we know they hide behind the shadow at all. We real and this them na all but we.
Every woman first, let me start that, always they look for a successful man. So likewise, majority of the men also they look for successful woman.
We they can't talk about we hustle and we they fair money.
When you like somebody, you first of all get for take care of whatever you like. Make them a priority.
We relationship and waiting people they expect from we man them.
You know, women are more emotional than men. If you start them, where you enjoy them, you go they come.
This not a side where we just they can't talk. This na brotherhood. Na side for let you see and feel what they really mean for B-boy picky.
Sex is intimacy.
This na boys. So come na the bar, grab a chair, buy a drink, let we talk, chill and vibe. Cause this na boys who side where they shake the table.
Ask the question, why and wetin go be the impact? As studies on the show say, the triplets sick them, syphilis, HIV, and hepatitis, don't they on the rise? In as much as they are not new, but the recent studies, they prove otherwise. Now, making the studio, we go get Ibrahim Samuel Duba, we're a director, drug preventive education and training, na NDLEA, and Habib Kamara, executive director, social linkages for youth development, and Lucia Badruz Benitez de Lugo. We go join we on the line all the way from And firstly, before we go, we get within Amara Lebi, when the Human Rights Technical Lead on it, the HIV and AIDS Secretariat, tell we about them findings so far in relation to this sick them.
As a country, we'll be begin, we get 0.9% of the population will get HIV. But it don't grow, it go to 1.5%. Remember, this is a study with they do every 5 to 10 years. 5 years, the first 5 years they do them, that be 0.9. It go to 1.5. The following year they do them, the following 5 years they do it, it still remain at 1.5. Now it don't go to 1.7. And that means the number they go up. So you see, the number of people we get, they go up. But not to also that another thing, it also means if we get the number of people we get now that number, we also need to make sure the population protect itself so that we don't get more people they get it will be new infection. Because it means if you get affairs with somebody who get HIV, you go get them. I want to let you understand, forget HIV, it's not the show purpose in body. It doesn't show a person face. It doesn't show whether you dry or fat or whatever. No, now only way you can reach AIDS, like people they can able identify that one day. And for let reach that day, it will take between 10 to 12, 15 years, you know. So it take long time. So what's important for say, when you they use condom, you they protect yourself, number one, you they protect your partner. But also condom, not forget we they use it for what you call combination prevention. That means even if you they say I they protect myself, I don't want to get belly, you they take Captain Ban. Captain Ban not go protect you from letting you not get STI. Because let you not get HIV. Because if you go get sex with pussy where you get STI, you get HIV, you go still get her. So what you can do, they talk about what you call combination prevention. That means even though you use Captain Man, you also find out you get condom because that person they meet, you don't know his status. So that's important. And HIV, you know they show per person until between 6 to 12 weeks from the time where you get her. So important let you know, important for let you understand that one they say, condom will protect you, let you not get HIV, let you not get STI, and also it will protect you from unwanted pregnancy. But if you get Captain Bar, or you use coil, or you use microgynon, or you use depot injection, it will protect you, let you not get belly. But it not they protect you from STI, it not they protect you from HIV.
Thank you very much. Welcome back. So here in the studio, we get with us Habib Kamar. Good afternoon. Welcome to the Today Show, Mr. Kamar.
Yeah, good afternoon. And good afternoon, viewers and listeners.
You know one person we don't work with different set of peoples, particularly the youths them. And I'm sure you're aware, these findings come on amongst users, them, we are the young people them. In that regard, what do you get for say?
Just like what Mr. Lebidi say, studies don't tell we, say the current HIV status or HIV percentage in the country is 1.7, which is about 78,000 people in Sierra Leone are living with the HIV disease. And again, on that same program, we want to go cover. And somebody from the National Hepatitis Unit of the Ministry of Health says we get about 13%.
13%.
And it is obvious. The population where they work with, which are vulnerable population, drug users, the injectors, just the injectors they work with, it is scary. It is 4.2%. We even the national general population is 1.7. But a subset of the population where they work with, then are 4.2, based on the studies and research. And we therefore taken as serious as a country. If the dynamics don't begin go that way, young people has to protect themselves when they want to go into sex. You have to have a condom negotiation. But the way how the narratives they go on at the country, young people are on substance abuse. When you are under substance abuse, you have an impaired memory. Even to negotiate for condoms when it comes to sex, you know, good one. So that means we are craving the indulgence of young people that when doing mommy and daddy business now, we really get for caution, we get for negotiate for condom. Just like Amara said, you know, if you get HIV, you know, will tell on your body. Past it reach the state of HIV, where you go wrong get now, that not the worst stage standing now, where you did at the end of passing away. So you will see that your body don't down or it is. So they call upon young people and people of Sierra Leone for more really take this issue very serious.
So when I do a study, we talk say 26,000 people in the when are drug users. So where they wanna be they do then statistics then there? Are you saying that the drug users them now this whole thing common amongst?
No. That study what we do in 2021 through the National HIV and University of LEONE, Ghana, and which we call the IBBSS, the Integrated Behavioral Survey. We will be doing them 9 leads. And not all drug users will be reached out to, just as a set of drug users, those are the injectors. We did it in 6th district in Sierra Leone. Western urban, western rural, Bo for the south, Makeni for the north, Puloko, we do one at Kenema, and we do one at the extreme part of Pujong towards the border crossing side. So the study be tell with those that are injectors are now 26,000 injectors what we get. And among the 26,000 injectors, we have among them who will be do the steroprevalent among them, 9 make we able get 4.2% of that 26,000 people. And with the behavior of injectors, and it is faster when you exchange needle and syringe. If you're an injector, you inject with needle. It is easier. It is 96. It is about 96% at risk of getting the HIV, even past the mommy and daddy issue, because the needle, whenever somebody don't inject with needle, you don't know say that person sick. He pass that needle give you that person. If you inject yourself with them, you still get that blood with that person, but don't inject himself.
So that make one be the push for the needle and saying.
Nine make not to be the push one. That is the best practice and WHO guidelines. If we want to attain as country or the world, we not for leave no population behind in terms of treating HIV, because people who inject drugs, study don't tell we say then they at risk of getting the HIV and the hepatitis B and C than even the mommy and daddy issue. So that is the reason the government try for the national response for incorporating into it. And working with drug users, giving them needle and syringe, that component is harm reduction. We are reducing the harm in the drugs practice within the drug through needle and syringe. If we are giving an injector clean needles and syringe, that person no go dey at risk for getting the HIV.
But I'm sure you go agree with me, say then CCR, so not only through needle and syringe, then they become transferable.
Yes, that is true. And for HIV, we don't get so many things. First thing is mommy and daddy business, which I first talk about. Yes, you get them through mommy and daddy, just like what Amara Lebi was saying. And you can see somebody healthy, but he's sick. During the time of sex, when I not do condom negotiation, you say like what they say, hey, I get prevention. For me, I don't get belly. You get captain ban. That captain ban no go protect you. For me, you don't get HIV. We get a combination like condom. Now, one of the most way of preventing you of not having. And again, we have a medication we call PrEP. PrEP, they call them pre-prophylaxia drugs where you take where they only protect you from where you don't get HIV.
Okay, so let's talk about hepatitis small. I know you're not a medical person, but you don't do 1 or 2 studies. Most people will tell you, say, hepatitis na through sweat, you dey get them. If person they pass, you get sweat, it jam you, you dey get them. So every day when you go out, you must meet with people, you must jam with people. So, I mean, why it's like not just on HIV no more? What about hepatitis SF? We a own way for transfer safe in common.
Now we have incorporated hepatitis in HIV testing. We get now triple testing. Whenever we are testing now, we test for other STIs, HIV. Because you have people, if you get HIV, you get hepatitis, a very rude at risk to your own life. Again, study don't tell we the one way they inject, more they at risk or prone for get HIV because of you just talk something. Say where you jam, they say they get them from sweat, where you and person come closer. Another way form of getting it, you get it again through injecting. So that is the current study and that is the current WHO guidelines in terms of reaching out. Yeah, I am not a medical personnel,
yes,
but I'm a public health expert and being a civil society activist reaching out to this vulnerable population. If we want for the country, make we attain, reach out to them people in there, when they do this testing, we go for test the populations there, we then 3 things that we don't say. Because early detect, early treat. If you have been detected of having HIV, you start your medication, you can prolong and live long. The same goes for hepatitis. Wait, as soon as they don't detect you, you start treatment, you can be cured. But if you left it on, it degenerates to stage where medication or good, your life could be at risk. And other STIs like syphilis and other gonorrhea, glaucoma, with all the tests. Because with the test for them things a day, because if you get HIV, you get the other underlying sickness, then it will be hard for the treat. So that is the reason we reach out to them people then in terms of doing that test. And any human being, you need for test. We perhaps you don't do unprotected sex, or you need sex with condom, that condom don't bust. After that sex, you need to test. But now after every 6 weeks, like if you don't do unprotected test, you go test yourself, it look negative. After that 6 weeks, you need to go test again. Perhaps that time where you be test, where you become negative, after 6 weeks you go test. When at the actual formative stage, and the way you don't go test. The time where you can test 6 weeks back, you know, be get. Now when you don't can test, you get, you for start your medication. When you start your medication, and for that entirely I won't tell you, say, early treatment go prolong your life and it will even put you stable. Hence, you know, default of using your ARVs, your HIV drugs, you can take. And after you use the ARV drugs, after every 6 months, you need to do what we call viral suppression. Viral suppression, they need to take your blood and test your blood, suppress them, for me they really know how many virus within into you. Hence, you know the default you take. You can even, time will come, you can even sex now, you know, the transmitter, because your viral suppression has been suppressed. That is the reason the WHO and the UNAIDS says by 2030, if only we follow the procedures, no country no go day we will get a HIV challenge or a public health challenge. That means 90-90-90. Reaching out to 90% of the population, testing 90% of the population with HIV, and the 90% you reach out to, you put 90% of that population on treatment, and the last 90%, it is the viral suppression you will put on the one then we put on medication. If only we follow these narratives, it will reach a time HIV will not be a public health challenge. With the present strategy the nations to go on with the minister the Minister of Health, he's very knowledgeable on HIV and he don't work on HIV programs where he be the work na CDC. And he now say Sierra Leoneans who came come on 1990 make will reach out to 95. Reaching out to 95% of the community, test 95% of the community to know their status, and reach out back to the 95% for me to know the viral suppression. If only the country people ready for test. When you test, it is necessary for us to test. When you test, you know your status, you will now protect yourself, how you do sex, how you do other things.
Okay, that only they are small. So on the line we get with us Lucia. Hello Lucia, are you with us? Can you hear us?
I can hear you.
Okay, you did some findings about Kush being going synthetic drug challenge in Sierra Leone. Kindly tell us how did you go about your findings?
Thank you for the question. We started this research actually at the beginning of 2024 after we had been asked by elements of the Sierra Leonean government for support in finding out what was Kush. As you all know, Kush was linked to the deaths of a lot of people, but there were so many unanswered questions. What the chemical composition was, how it was coming into the country. So we at the Global Initiative designed a research study to try and answer these questions. And we designed it in partnership with the Klingendel Institute, and we also had the support of the governments of Sierra Leone and Guinea-Bissau. We also worked with civil society organizations, both in Sierra Leone and in Guinea-Bissau, to conduct the research, including SLYDC, as well as IDCHS within Sierra Leone. We conducted field testing of Kush in Freetown using a piece of equipment called an FTIR spectrometer. This showed us, it gave us a preliminary indication of what was in Kush. Then we sent off, with the help of the government of Sierra Leone, some of these Kush samples to a laboratory in Spain to do confirmatory testing to be very clear what was in Kush. We also spoke with over 100 people who use drugs, as well as doing interviews with a number of other key stakeholders to make sure that we had all relevant data about how the Kush market was working.
Okay, so what are the key findings that you got in your report? Hello, can you get to us?
One of the major findings was the chemical composition of Kush. Our chemical testing confirmed that Kush has the active ingredient. The active ingredient means the chemical that really has an impact on those who use the drug. It has one of two key components. Firstly, a synthetic drug called a synthetic cannabinoid, a very specific one called MDMB4EN Pinnaker. Why does it matter which one it is? Because this one is very strong and it's very common in other drug markets in the world, including in Europe. The second key chemical component of the drug was nitazines. Now, nitazines are a really addictive and deadly synthetic opioid, which is very, very strong and has a very high risk of overdose. So, for example, we know that there's a synthetic opioid, fentanyl, that has killed thousands of people in the United States. The nitazines that we detected in Kush in Sierra Leone, there were 3 main nitazines, and they were the same strength as fentanyl, 3 times stronger and 25 times stronger. And nitazines have been linked to overdoses around the world. So clarifying the composition of Kush and explaining why so many people were dying was one of the key findings of the report. Perhaps a second key finding was that these components, synthetic cannabinoids and nitazines, we do not think that they are made in Sierra Leone.
Okay.
Our research pointed to imports from countries overseas of these core components. And we mapped the supply chains and the trafficking routes. And we found that some of these components are being imported via maritime routes from the Netherlands and most likely the United Kingdom. But it's unclear if these components are only the synthetic cannabinoids or also the nitazines. Our research was not conclusive on this. Our research also identified that these components are being imported via postal courier services from China. China is a major global manufacturer of both synthetic cannabinoids and nitazines and is identified as a source country by a lot of countries in the world. And we found that individuals in Sierra Leone were buying some of these components on websites, online, websites that allow suppliers in China to sell their products, and then they were being imported into Sierra Leone using postal courier services.
So how dangerous is this nitazine to human consumption? Hello, Lucia.
Nitazines are extremely dangerous for human consumption. There is no legal use for nitazines. The risk of overdose with nitazines is extremely high because they are so strong. So taking too much can easily lead to death, but also they have very negative impacts on a range of the internal organs. So people who use nitazines can die from an overdose, but they can also suffer very severe health impacts over time as their internal organs are very negatively impacted by this drug.
So what is the way out of this? Are there remedies, in order for people to not to be addicted to this particular findings that you got us?
So our research identified three main pillars of a response, and these are the recommendations that we make. Firstly, we need better monitoring, better early warning, testing and information sharing in Sierra Leone and other countries in West Africa. There was an delay between Kush first arriving in Sierra Leone and us knowing with conclusive publicly available information what Kush was. That delay means that Kush really was able to embed itself in Sierra Leone before we knew what the drug was and how to respond to it. Now, we need to be able to identify new synthetic drugs and confirm what they are and where they're coming from quicker to establish a stronger response. Secondly, is the disruption of the supply chains for those key components that are coming from overseas. So all action needs to be taken all across the supply chain by China, by countries in Europe that have been linked to exports, as well as by Sierra Leone at the points of entry. So that's the airport as well as the maritime port. And the fact that postal courier services are so important in importing some of those components means that collaboration with the private sector, the companies that are really providing those postal courier services, the fast post, is absolutely critical. The third pillar of the response, given that Kush is already so widely consumed in Sierra Leone, is to reduce the harms of Kush consumption, so including through prevention and through public education, as well as better access to treatment and support programs, as well as medication that can reverse overdoses from nitazines. That medication that can reverse opioids is naloxone, which is increasingly available in country. And in terms of the rehabilitation and the treatment that can help people stop using Kush, it is important to consider opiate substitution programs to help people stop using Kush. It's very difficult to, from one day to the next, just stop using Kush, and people will need a lot of support.
All right, okay, let me just hold you there a minute. Lucia, please stay with us, and let's turn to you now, Abib. So, Abib, you hear all what Lucia don't say. And you know, things say we need more push, because it's like, it just, okay, let's start first with Kush. It's like, even on our findings, on our focus more on Kush being a synthetic drug. Is it that not only among the Kush users them, firstly, that then 3CK go simply be spread among people them?
No. When I say opioid, it talks about opioid. Opioid, not to Kush no more, not opioid. Opioid, even the tramadol is an opioid. We get what we call brown at this country. We don't take all that na opioid. Anybody really take opioid, na person we for me una transformer, una need for and administer like what he talk the opioid substitutional therapy. We na the OST. We una need for give that person, and it talks about naloxone. Naloxone, it say it is now available in the country. Now for overdose, we don't see in the country lately from 2022, 2023, 2024, there has been a lot of drug overdose. And we brothers they die in drug overdose. More the one way they take Kush. The remedy for that, not the naloxone. And the sick, yes, when you are drugged, you don't get impaired judgment if you the way say, but again, with waiting we they see, man the way they take Kush, no get too much what say for sex than the women. We don't say when women the way they take Kush, then get sexual perversion. And then women the way they take Kush, we get sexual perversion. They get multiple sexual partners, and they do sex without using condoms. Then they at risk of getting them diseases there. Hence, you get in multiple sexual partners, and you do not know the status of your sexual partners, and you do sex without condoms. You can fall victims. So. Now that I get for that question.
All right, okay. We can't talk about the education side, but slow just turn the mic quickly to the street and get the views about Sierra Leone and their understanding about this and what and things it needs to be done.
Well, this is not good for we, especially we the youth them. At this country, this kind amount of HIV where they go around, now we country. Especially with continent as a whole, Africa. But now, they advise me, my fellow citizens in Sierra Leone, Lord, we be careful on this disease where they go around, on this HIV, due to the mommy and daddy business we would engage on. Because now the more than we capture the disease there. So, they advise me, my fellow men and my fellow Sierra Leoneans, when I youth them where they engage out there in terms of sex, so they are law will use protect and law will protect the system them in terms of the sex. At least we able prevent yourself from them disease there. So do please, then do to anything so far where somebody want use the old bleed. Please, law will avoid and stuff in the back. And stuff in the back can lead back to HIV back. They use bleed, they use needle there. So do please, Lord, we avoid them, please.
Well, this number of HIV affected people the way we get now in Sierra Leone is too much. And it's not good for the country. And me, the advice say, please do let doctors then go around the city and sensitize people about this sick care. And I still advise young people and girls, men, at least where they suspect say this TR, then get them, let them go to the hospital, let them try for take treatment. And please let doctors then come out sensitize people about this sickness here.
No, this can be not safe. Even me now, not safe. I don't know say I waka because they say they waka different way. So even me, I'm not safe. What do you think? How the world London at the end of time, make people then turn to God. Now so me think say that the right thing for do. Right now the fornication number cool, prostitution number cool. So the only way was to say na him go happy for stop this or reduce and make people then turn to God. Make them turn to Allah. And the best way I go to solve this thing. Because the fornication, all the right now small people and they small people are not even reach 12 years and get iPhone them. All kinds of things and phone them. So the fornication, they had more and more. So you find out say sex life don't be common at the wall. So the only way I get for tell people and tell family them, make them turn to Allah, make the rough life where they live and stop them. Make them turn to God. So if we can do so, it go better at the wall.
For me, we not say God that to be careful yourself. We for be careful yourself because our citizens we don't die. We will get that amount about that. For be very be careful. Be young boy now, young girl, for be careful yourself.
Those were views of some Sierra Leoneans. Abib, you don't hear what they say. And from what me get, it's like people only think say this stick here and only through mommy and daddy business that you get. And so you think so we don't give justice to awareness to the public?
No, not a true and mommy and daddy business no more. You contact HIV/AIDS, and you contact HIV/AIDS through injection, through venous injection. If you inject drugs and the other person they share needles, that's one of the fastest way. 96% they are at risk for make you get them. And again, they go in for health treatment. It is now time for use pepper doctors. You go to pepper doctors them. For that pepper doctors, they use one needle per 1, 2, 3 people. Then it is not correct. A needle has to be used by one person. After that one person will use them, we for what he said. Now time not even day again for sterilized needle. We not for sterilized needle again like how forced them then get for boiler. Perhaps you boil until you know we're able to do that. Not only from the mommy and daddy issues will they get this HIV. Again, where you want born, no go to quack person or somebody with a bad tender. Because even when woman they get belly, where it born picking, na blood related issues. And if they not give you safe bad tender, you can get HIV again. Or if you get HIV, through where you born, you begin through that blood with yourself, you begin self coquetta. So not only mommy and daddy business no more. The education really needs for go down that not only mommy and daddy business, injection, kingiam, and other way. You have other people who do sex through Anna, where they do Anna sex. Anna sex, excuse me for the language, this is the first month. The one that they do sex through the waist. And the waist, now only one thing God give lubrication to. Now through the woman vagina. But the waist not get any lubrication. Any sex will go through and laceration, bushes then get for happens there. So we call upon people that when you do mommy and daddy business, who say God say na they for do mommy and daddy business, na they for do. That is the only place where you get lubrication. Lubrication means we get wet, where you be able to penetrate and get inside. But through the waist, you get woman where they do and through the waist, you get man and back where they do and through the waist. So lubrication get for the if lubrication no the na wound you the wound. If una do one without condom, that person, if either the woman get any disease, you the man, if you don't get disease, you the carrier because lubrication are already formed.
Okay.
And you, the woman, yourself, not the same thing. So at the call upon young people, because we have young people now, the way how the world they go, the way how they live. We even get friend, woman and now when they pass, then for they pass, then they go use one man for money. And when they go, you don't know you party where you and they go lay down for one man. And that person when they go meet, because they get money for give at that time, when I don't negotiate, say, okay, go give me 500,000 when two. They go use una. If I don't know that person in status. So use condom. Use condom for the thing and day. And the twosome, threesomes where people then they do, that again don't they increase, because when I go do one nakedly, you don't know your friend where you are in the worker in status, or the person where now a client for that night, when I don't know in status.
Okay. Let's just go quickly to Lucia. Hello, Lucia. Hello, are you still with us? So, in your findings, yes, can you hear me? Hello?
Yes.
In your
Yes, I can hear you.
In your findings, I mean, you talked about the protection the pushers are getting. How did you come about it? Hello?
Our research identified that one of the factors that had enabled the Kush market to entrench itself in Sierra Leone was, to some extent, elements of corruption at the points of entry, most importantly, the maritime port, but also the airport, as well as collusion with some elements of law enforcement protecting the retail part of the trade. When we talk about the retail part of the trade, we mean the local synthesis by cooks, as well as the domestic distribution by networks that take the bigger volumes and then distribute them to spaces where they are sold to people who use Kush.
So what are the implications? Are there any implications?
The implications of the research are that it clearly demonstrates why Kush has been so deadly, why Kush has been so addictive it's been so difficult for those to stop using Kush once they become addicted. It also really made clear that closing those loopholes in the airport and the maritime port to stop the Kush getting into the country was also very important.
All right, okay. So let me just turn quickly to Abib. Abib, with all of this, you're waiting Lucia say, the corruption, the this, the dandy. What's like this for Kerigo? Because it's like with the fight for something we not actually get an end.
Yeah, in terms of drug issues in any country where drug is strive, that country, it becomes a criminal country. It becomes, let me see, the country will get bad name, will get a lot of people. And in terms of drugs cartel, na cartel of a industry where some even get money past West African governments them, like the supply route. We don't see and say the supply route is being protected than even the users. Yusuf can attest, before the presidential and declaration of substance abuse, and more especially on Kush, we will see the energy and the zeal where communities they get. If they over social media, they get people in their communities, they go and hold them, Kush users them, they barb them, disadvantage them, and do a lot. But we see and say, after presidential declaration, like maybe they think and say, the energy we get on the users, that energy should have been overturned to the supply route. Because Kush now inside communities, then they manufacture them. Now inside communities, then they sell them. And now inside communities, then they use them. And all of we were there now with different communities then, where drug-related issues they happen. We know whose side they make them, we know whose side they sell them, but we protect them. And if this continues to stay, we not go get people then tomorrow for replace you. For replace we, the workforce of the country no go there. And we are seeing what Kush don't do. Majority people the way the government rehabilitation center somewhere in tertiary education, they don't drop out of education and they are now sick. They don't take them to that rehabilitation center. And some of them, when they even come back out from the rehabilitation center, they don't get proper reintegration. If somebody don't get proper reintegration, they go to what we call relapse. Relapse means I be done the honor, but I don't left for a time, but I don't count on them back. When that person get for count on them back, they count on them real serious. So as a country, the supply routes now will challenge. We really get for power, we really as a government, as individuals, as people in communities, we begin in the community. You go say, I'm not going to name that person there. Based on peer pressure, you pick you go to protect them. Where it near you not go do them. Sometimes when you don't go to school, based on peer pressure, instead go begin testing. So, all of us has to put our hands on deck. If we really get for really see that this thing minimized. She talks about corruption. Yeah. The corruption they come in, the law enforcers now, people again, brown envelopes, they now back they come into people where now people then we well position. And like police one go raid today Lumley, a particular place. Before police they left. For going to that place, they don't take phone call. And police, when police they go do raiding, government is spending more because the motorcar when they use, now fear government buy them thing and they with. Even the big when they use, now resources when they use, and even the people them way they go on that, then get something with a risk stipend when they give them. So in all of this, as a country. But we miss this drug issue as a country, where the war done at this country. Where Pakababi talked in 2001, say war done. After war done, we went into DDR, demobilization, reintegration, and resettlement into communities. And in the TRC report talks that 85% of the one that we fed the war, we are using drug and substance abuse. So now then people in back will see, after we don't reintegrate them back into communities, we will not do anything about drug rehabilitation. Now they now go to communities, begin take them, and begin with it. And drug now something very heredity. The current population where they take drug, now siblings they were born during the war. And most of their parents were drug addicts. And we did not do anything about it. And up to now, government now we try to get rehabilitation centers across the country.
So you think Nayanda the missing link?
That's the missing link. We could have targeted drug-related issue since 2001 when the war finished. If we target drug-related issue from 2001 to now, Sierra Leone for done strong in terms of rehabilitation.
So let's say, assuming them we've been targeted and then they will not lead to all then things sick we don't go on an increase. So
and yeah, rehabilitation as all then sick there where they go on. Sick na social issue. Sex na social issue. All then thing there boys along social activities. Daytimes you go to Aberdeen Beach or Lumley Beach, you see that. Not just what he said. But at night when you go the way social activities they go on, you see a lot of what. And not only push down they go on. We get a drug where majority now young girls them where they socialize. They take ecstasy.
Okay, so
and ecstasy available in the country Just like how we see kush. And we young people, then they honor. And they don't even incorporate elder people in terms of sexual perversion. And you watch most of them ladies, or most of them boy picking there when they take what he said. You can see that yesterday now all be there now chilling, it don't die. Because extra C, where they take extra C, instead get a overdose alignment the way they do. If it means that you get underlying diseases then, or underlying sickness then, you get diabetes, you get kidney problem, or you get other sickness then, you go take extra C with alcohol. And they are taking extra C with alcohol. How can you take extra C and alcohol? You don't make the chemistry don't become so what? When you take them, if you're not possible, you get heart problem, or you get kidney problem, or you get high blood pressure, or you get sugar problem with diabetes, you go hit them, you will say, Bokuman, they die.
So now look connect the nexus with all what you explain. So this then if you getting sick there, so going to the brown envelope together to Tin Lucia say and that. No nothing said that attendees for una push for the protection for injectors then or drug users then at the country.
Yeah, we are pushing it. And the only way we can push it, the 2008 Drug Act what we get, not be make provisions for harm reductions. We are calling upon the government, President Bill, on his first opening of Parliament in May 10th, 2018, said that his government will review the 2000 drug law. For us, that drug law came into being when the cocaine plane landed in this country under the then government of the APC, and the then Parliament rushed under certificate of emergency for me to get law. By then there was no law or there was no act for me to try the one the way we can with that cocaine plane. We, from the inception of that law, we see and say Boku areas they not be there as best practice, more especially the harm reduction, the social justice related issues not be there. But we still have time for me to able to actment. We were able to incorporate harm reduction into the Sierra Leone Drug Act and harm reduction into the health policy. In other countries, harm reductions, they are the health policy. People, they come in hospitals for can take waiting at talk about harm reduction. Harm reduction in drug-related issue, we have 3 policy-related areas we were able to minimize drugs. One, the drug demand reduction. Drug demand reduction, the National Drug Law Enforcement Agency, we are the regulators them, and we are the law enforcers them, and they're supposed to do that. They're supposed to reach out with all messages to every part of this country. But that agency is illy budgeted for. That agency just get about 19 to 20 staff for the whole country.
So you go wonder how they go do the
work. How we go wonder how they go do. If we're really serious as a country, that entity will really need for put attention. Today is kush. Another drugs are not the tribes for coming.
Let me go really talk about time for the watch, because somebody tell me say in fact a new one don't come where they call Take Me to America. They say when you take them, you don't even feel like you're in this world. So by the time they do findings, by the time they try for the find solution to this, sometimes take me to France go don't come now. The end of the day, waiting the left to you Monday.
And then 2019, now third presidency, we get Pampas water. People begin with itself. We see how Pampas water. So leaving young people without employment, or with the left young people them, they cartel. Now they really get what he said. They cartel, they think because they want to formulate forget money in the expense of the people. Kush used to come. But when I see say the security apparatus don't block so many ways, they can begin concocta now, begin come with different chemical substances, different particles to the country, and form that. Now, where one issue they normalized. Now Kush is still there, it's still the tribes, but the way how we see them, we know the science again also. One, to me, at first when they begin concord there within themselves, the network, they don't get the chemistry correct yet, but they don't get the chemistry this meantime. Yes.
With the chemistry.
The chemistry, how for titrate then chemicals then for give a product. But what Lucia said, nitazine, it is 100% potent than other drugs then. Like, so as a country, we really get for put attention to we maritimes within they come in and we airports. Because I want to say thanks to government. With a preliminary report become more, there was 30 recommendations made that we want a bill of lading. What they call bill of lading? Then chemicals the way they seize, where we know say, nah, in any take make kush with. We want get we want see them bill of lading. More we know the countries then we then chemicals they are they come on with and they seize. Now that make the researchers or the study tell you say a point at Netherlands, a point
UK.
at China
And UK.
and the UK.
Yeah.
So because government be able make available to them things again. Again, the testing what we do. Now we be want me go na a secondary laboratory na France. So government through NDLA, the Ministry of Internal Affairs, through the judiciary, they be able to give a support for me. We send the substance there for me we get the final and secondary and evidences. We really now go to them place there. Before them, we say now for my DI, formalin, now motamambo. But all the tests they will do, we will not see none of them particles they are there. Now then chemicals they are. And then chemicals they are used for come with particles. Then they come with some money a ship container, they put her inside a motor car, they put her inside toilet within themselves. So as a country, we really need for we self would think ahead than the cartel. Again, she talks about corruption. All boys along corruption. Because when these things comes, they have an entry point. And this entry point, we have security apparatus there, which are paid from stakeholders and citizens and taxes and when they pay. If you did at them places, then they will really get for see what's in the can of this country. You can there under you hold Brian envelope tomorrow. But when you don't come make the substance until you picking go be a victim.
Okay.
Your brother and sister in picking go be victim.
Okay.
So we really need for work as civil unions. And drug, after food, crude oil, drug are the third largest industry, more illicit drug. So drugs, not to civil union no more get drug issue. Drug issues they now all over the world, even the Americans.
I'll come back to you shortly. I'll just go to Lucia. Hello, Lucia. Hello?
Hello.
Yes, lastly, before we go, what would you recommend your findings be addressed in all aspects so far in Sierra Leone? Hello?
Sorry, I didn't hear that properly. Could you repeat the question?
Your findings, what would you recommend its address in Sierra Leone?
It's clear that the response has to be both across the supply and the demand side of the market, that it's critically important to try and disrupt the entry of these chemicals and their precursors through the airport and through the maritime port, and to work with postal courier companies to step up the screening and scanning of postal courier imports and try and stop some of these components entering the market. But it's also key to make sure that more people who use Kush are able to access treatment and support, and that treatment is based on evidence about what Kush is. So its chemical composition and what that means for the support that people need to be able to stop using Kush.
All right.
To summarize, those actions need to be on both supply and demand, and they need to be based on evidence and information about how the Kush market operates.
All right. Thank you very much, Lucia. Habib, before we go, in a nutshell, then the Sikiaso, they're on the rise right now. What will be the impact? Who side this get for left we if today we not take action?
I believe the national response, more especially for the HIV national response, and we get the implementation strategies, both for the general population and for the key affected population or the population at risk. There is the roadmap towards that, and there is a roadmap. The sustainability side, in this side, now donor driven. Like some aspect we see with Donald Trump coming, it cut up all length and day. Government need for raise domestic financing for complement this action, because people that has been given fundings for us to be able to reach out are now saying their funding should not come. So the sustainability part of it, government has to be budgeting towards the medical or the health sector for make we able get both finance and technical and support of reaching out to them population here, and again incorporate and sexuality into our basic education and drug and substance abuse into the curriculum of our schools. Me picking them begin know about sexuality life, and me begin know about drug and substance from school, because when you catch them when they are young, they don't already know what are the
advantage
and disadvantage. Then go know now how do they go guide themselves, how then they becomes an adult. So that's we for try for do as a country.
All right. Thank you very much. Habib Kamara, we are the Executive Director, Social Linkages for Youth Development, and Lucia Barruz Benitez de Lugo, when a Director of the West Africa Observatory Global Initiative Against Transnational Organized Crime. But we go on for left you again with Amara Lebi, the technical lead, na Aid Secretariat, as he give you some advice for how to prevent yourself from then sickness, so especially HIV and AIDS. Don't forget for join me also as the next of the program will be continued by John Abdullahi.
For example, for letting not get HIV, we get what they call PrEP. PrEP drug the way people they take. Once they take it consistently, like you get sex with person, the chances for like get HIV very slim, because the efficacy high. But if you do that one day, it's still not going to protect you from pregnancy. It's still not going to protect you from STI. So you see, so now make we talk about combination prevention. And condom, now one of them we go give you, go protect you from all three. Well, very important. Well, as per design of the comprehensive sexuality program, they're supposed to teach them about all the prevention methods for letting them be exposed to them. But in addition to that, there were body people there, or also social institutions where they work with family planning, HIV and AIDS. Then desperately we come together as a country for look at all the different possibilities for rich people with the knowledge and education what they need for help them for know correctly. Number one, about prevention. method, all the opportunities where they're supposed to sabi. So whether you not begin do sex ed, you're supposed to get knowledge of them. You know, the available opportunities where they. So that at the time where you deal, where you want for start, you know what for do, you know how to protect yourself. But also you want for engage the one the way currently they at that age where they don't begin for do sex for protect them. And one of the things that they encourage the number one, for that they test for make sure say they're safe. They not get HIV, they not get STI. You understand? They not get pregnancy. So you get test kits if they don't begin do sex for prevent them. But in addition to that one, once you don't do them test there, you need for now look at prevention strategy. And one of the methods they look at is combination prevention. Different things they all go inside one pack. If you want to protect yourself from HIV, you get HIV drugs where they go give. Like I tell you, PrEP they you go take. But even if you take PrEP, you still need condom for help you for let you not get STI. You understand? If somebody get HIV, they live with HIV, they can still get healthy sex as long as you use condom so that you not transfer to somebody yet. So all that is part of the education they look at for let people they know that one day. If somebody they college, a day school, a they work, they don't begin work, they want for make sure say able for succeed on the career, a need for space in beginning, a need for able to take advanced career goals, they want for study, if for able for prevent itself for space in beginning, and wait till they can to combination prevention. One of the effective method and cost effective also na condom.
I don't want to let you connect to the
Man them. This na boys. Usai man and they put all thing at table from Pantap to good inside boys. We know they hide behind with shadow at all. We real and this them now all but we.
Every woman first, let me start that, always they look for a successful man. So likewise, majority of the men also they look for successful woman.
We they can't talk about we hustle and we they fair money.
When you like somebody, you first of all get for take care of whatever you like. Make them a priority.
We relationship and waiting people they expect for we man them.
You know, women are more emotional than men. If you start them, where you enjoy them, you go they come.
This not a side where we just they can't talk. This na brotherhood. Na side for let you see and feel waiting it really mean for me boy picky.
Sex is intimacy.
This na boys. So come na the bar, grab a chair, buy a drink, let we talk, chill and vibe. Cause this na boys. We side with they shake the table.
Are you a lady going through issues in a relationship? You dey chop breakfast, you dey see pepper, my sister, you don't know who to talk to. Well, welcome to Girls Talk. Here on Girls Talk, we discuss everything that has to do with ladies and their relationships. Also, we get for the play entertaining and exciting games them. Not forget the gist part. Of course, Time Maggie get for the take place now. Always watch Girls Talk right here on Flick TV, channel 37. Get a nice.
Many thanks to Rabiatu Mansari for the first segment of the show. Now we move into the second segment of the show. We go take tech news from Paulina Bendu Samba.
Welcome to Tech News Updates with me, Paulina Bendu Samba. Today, we are looking at a bold financial goal set by Spotify as the audio streaming giant aims to hit $100 billion in annual revenue within the next decade. This ambitious target was announced on Wednesday during the company's first investor day since going public in 2018. Spotify also reassured investors that its expensive push into podcasts and audiobooks will soon yield high-margin returns, an effort to reignite Wall Street enthusiasm despite a slowing global economy. To achieve this, Spotify will need to grow its revenue nearly tenfold from its 2021 figures. Following the announcement, the company's shares surged by 6.5%, though it has still lost 53% of its market value in 2022. That drop is even steeper than the 24% declines in the S&P 500 Communication Service Sector Index, which includes Spotify and other media firms. However, Spotify's CEO Daniel Ek remains optimistic, telling investors that the company is performing better than they probably expected. With gross margins at 28.5%, Spotify is well on its way to achieving its long-term target of 30 to 35%. One of the key factors delaying this long-term goal is the company's aggressive spending, over $1 billion invested in expanding its podcast and audiobooks platforms. Despite the high cost, Ek believes these ventures hold huge profit potentials, within margins exceeding 40% in the future, though he didn't specify how long it will take to reach that level. So far, 2022 has been tough for the streaming services like Spotify and Netflix, but the Swedish company continues to add new users and paying subscribers each quarter. This growth persists despite recent controversies, most notably backlash over hosting the Joe Rogan Experience, one of the most popular podcasts. And that wraps up today's Tech News Updates. I am Paulina Bain-Desamba. Till next time, stay informed.
I don't want to play connecting to the
Man them. This na boys. Usai man and they put all thing at table from Pantap to good inside boys. We know they hide behind with shadow at all. We real and this them na all but we.
Every woman first, let me start that, always they look for a successful man. So likewise, majority of the men also they look for successful woman.
We they can't talk about we hustle and we they fair money.
When you like somebody, you first of all get for take care of whatever you like. Make them a priority.
We relationship and waiting people they expect from we man them.
You know, women are more emotional than men. If you start them, where you enjoy them, you go they come.
This not a side where we just they can't talk. This na brotherhood. Na side for let you see and feel what it really mean for me boy picky.
Sex is intimacy.
That's not the tech news from Paulina Bain-Desamba, and now we go into the world of entertainment as we get Slim busy with you. Slim, welcome to the show.
Thanks for having me, my brother, man. How you doing?
I'm doing cool.
Alright, that's what's up. So today we'll go straight to business.
To the point. Exactly.
Alright, so let's talk about Amara Dennis Ture, where now the entertainment ambassador Cow Dinero as they don't nominate him now the African Golden Award. This is huge for Cow Dinero, as of course, now one of the prominent rappers that will get in the salon. You know what I mean? They alongside Gambians, Ghanaians, Guineans, people from Guinea-Bissau, and also Kenya. To name but few of the people that within this category, you get the likes of the Ghanaian Manifest, you get Nasty Steve from South Africa, you get Aya Baga from Nigeria, and also you get Calligraph Jones from Kenya. These are all top, rappers from Africa and are A-list rappers them as well. So for Sue Brother Man, Amara Dennis Ture Jalo, aka Cow Dinero, on this category. Of course, this is not a new award. This award done there around for over like 5-6 years. I think this is not the second time where Cow Dinero they been nominated on this very award. But of course, the previous one where they been nominated, unfortunately, it not be win. But of course, me I say, the moment them put him on the nomination list mean for sure say he actually don't they do well over the years. Now I make they recognize him from this small country, Sierra Leone, for the part of this very award winner, the African Golden Award. Of course, I don't know if my brother man gets something for say towards this.
Well, Now a good step for them, for letting you award, that don't show say they create a positive impact in the entertainment world. More especially, as an ambassador, go serve as a stepping stone for moving, to another level.
Most definitely. Yes. Actually win the award, it's for the nominator. But of course, the fact that nominate consider and say now
for win.
Yes, now somebody will go win this award. Let's move away from that again. As we get Okuna the play today, let's talk about Music Save Minds 1000. In real name now, in stage name now MSM 1000, and of course the M mean music and the S mean save and the M mean mind. This gap have been the na AYV Cypher season 2, I think, and of course been the battle and the doing thing. But now they doing music on your own professionally. They make numbers. They do very good visuals. Them, you know what I mean. I want for comment them for a move way they make so far. And of course, it gets in studio with a Matchbox studio where they do photography and same way so they produce music. This time around, MSM set for drop another song, and this one is titled "Not Call the Police." Like not call police for Monday. We just the chill. They get a nice inside life, so not call police. No listen to the teaser and then we'll come back when they get to another story.
No call the police on us. We they get a nice and the police on us. As we send a dog, nigga, all numbers. When we all my loss. I know they feel it's me foot again. Beyond me 5 on a born again. I know be no set up the African. The jamba they make out they go insane. As I jack me 8 knock. Me eye open me yes cock. Where I test me first change.
Now call the police on us. I am waiting for the song. Make it drop one time. Anyways, MSM 1000. Don't call the police on us. Dropping anytime soon. So watch out from. Let's move away from that. Of course, right now the youngins them that get the entertainment industry. I tell you what. Over the weekend we Suicide Bakiteno drop a freestyle and a call that one day from Accra. From Freetown to Accra, and that freestyle they don't spark a lot of drama. Like a lot of rappers they don't feel offended. It says some things them on this very freestyle, and the young man Rayboy Blue been gets for drop something, and similar so we don't see another rapper. Well, people they assume say this brother winner Maxi, another Sierra Leonean rapper we reside in the United Kingdom. He dropped a song he called this one Mail. It's a bit like when they send emails to person for reminder. So this song is titled Mail. And of course, when we listen to the music, as a music head, a music head, somebody will know a little bit more about music than the regular person. I feel like say it states something for the entire industry. But when I see some certain bloggers that make them post, they were referring to this song as if not a response to Bakiteno. But you know what? Me gets me take. You wait a while to get you take. So we could listen to Mail from Maxi the Professor.
It's the Professor. Right now, Dr. Lord, the whole nine grave. Shine the godson, go to wonder why then the peace time bed. Jimmy B go in a veranda with 298. They wonder how them taking paradise and turn and cool bay. Then say them bobo not get respect again. But it's Alex City, bobo then don't understand the game. So when you talk about BBB, then get gamadol for the pain. Where they in the insults and get umbrella for the rain. Respect yourself before you expect respect. If you know they get attention, I for accept neglect. I get put back to any ruler, man want guy for dissect the reason why these newbies they flex them biceps. What was the point of no more beefing, no more dissing? Cause the name the way them call inside the trap, they don't know be seen. Even when we try for talk to them big wire, no one listen. Till the industry collapse and now they not get pot for pissing. And see una no one change, we they change for una. And see una know the shame, we know the shame for una. I get una mail, I get una mail. I get una mail, I get.
And Max is say, until no one change, well, we will change power now. Anyways, Maxi, that's a nice one. I don't know what you take on this very song, but I'm sure it'll try for say how best. There's a lot of Sierra Leoneans we don't fight for peace, for let we stand as one when it comes to being entertainers. It mentioned the likes of Shine the Godson. If you remember, Shine the Godson before he passed, he gets a song we now in breakthrough song that we say No more beefing, no more listen. Rapper wanna make we listen. Shine pan pan. You know what I mean? If they speak to the rappers them for make we get unity. So it is say on this Maxi they say on this song, I wonder how Shine they feel right now side the way if you don't speak for peace and now we feel like say everybody just there apart. And he also mentioned Usai say Jimmy Bigo dina in veranda in Toti and na in head. So pretty much that's now within this song they speak about for let we all the unity and let's go off the hate and grudge. So the last thing we want to talk about today again, now we brought a man Lazani Bakiteno. As I mentioned earlier on, he been gets this feud with Rayboy Blue. So Samza, they ask why people they come at Lazani Bakiteno. You know, say that on today on the problem song. So he say now one word way this brother talk about the song now in the car with this beef or the smoke to ram. When are the penchy word? They say if rapper they want attention, make them pull the drums and penchy. That's it. So pretty much that is the thing where he say they make a rapper and they come at a rapper winner Lazani Bakiteno. So my brother, this now all waiting in the basket for we today.
I enjoy the song where say not call the police because many a times where inside life people they chill, you know, they call the police. So not call the police. Indeed. All right, Slim Peasy, thank you for the entertainment update. Well, we go move to Know the Law with lawyer lawyer Alpha Boise Kamara on the cybercrime. Abubakar Kamara be put this together.
Family, a good day or good evening, depending on who day where they listen to this program. This is me again, Barrister A. Boise Kamara. We're in a Bankeni Chambers, we're on number 5 House Street, Freetown. Today, we they come again at this program where they tell you what the law say for keep you abreast, for know, make sure say you know what's in the law and let you follow what's in the law because we want let you always stay on the side of the law, let you not fall foul of the law. So today we will talk about cyber crime. Cyber crime, this is a crime where person they commit, where they use computer, use phone, or using gadgets them when are electronic devices. Use them for commit the crime. You know, as you know, this is not the 21st century this, and the use of computer and other devices is very prevalent. So now in that direction, the government say yes, there ought to be a measure, a way for regulate the conduct of citizens online when they using device they are way in the 21st century. We get phone, we get computer, we get camera, we get all sorts of devices. So now the government, the salon, the state, the parliament, in 2021, they passed one law. This law then called on the Cyber Security and Crime Act 2021. This act here, then be passed on for provide effective and comprehensive, what they say, all-encompassing framework, legal framework. We include institutional framework and other things and for ensure say for prevent, control, and make sure say they establish a framework where they control the use and abuse of the computer devices there. So now, we get various type of crime them we fall under these cyber offenses. If you look at that act, you look at part 6 of the act, known as the Cyber Security and Crime Act 2021, it creates several offenses. Several offenses today. We have cyber stalking, cyberbullying, online sexual abuse of child, online adult sexual abuses, and other related offenses. But for today, We go for serialize them, we go for take them one after the other. Today, we will talk about cyber bullying and cyber stalking. We know one of the crimes within the Cyber Security and Crime Act 2021. And this cyber stalking and cyber bullying, they make an offense inside section 44 of the Cyber Security and Crime Act 2021. Now, within this section I talk about, it say any person, here when they say person, not to just mortal man. Because under the law, we get a juristic person, we get a natural person. Natural person are me and you, where they watch so. Juristic person or other persons, you get company, or other partnership, or other businesses. Then say the law, they consider them as legal persons. Then get legal personality. Because you can able to sue them, then say you can able to sue you in their own name and their own capacity. So they say any person will include any company or individual where they continuously, unwillfully, and repeatedly they send messages, send communication, either directly or indirectly to another person. Where you know that communication they go for get the likelihood for let the person where they send them to get fear. They put her in constant fear. Or afraid say they go damage in property, in reputation, or they can cause violence to them. Or you know say that communication they go detrimentally. When I say detrimentally, it go negatively affect that person day. If you do that one day, you don't commit an offense under section 44(1). And if they find you guilty, the law say, after they don't find you guilty, then they fine you an amount not less than 30 million old leones, when at 30,000 new leones. That are the minimum. And the maximum, now 50,000 or 50 million old leones, 50,000 new leones or 50 million leones. That are the maximum. Or a term of imprisonment, or they send you go jail for a minimum of 2 years and maximum of 5 years. Or, depending on the severity, the judge can decide, say, he give you all two, both the fine and he send you go jail back. But if you were one in a company or corporation, then they fine you no less than 100,000 new leones. That are the minimum. And the maximum, now 250,000 leones. Now, if you go back to section 2, subsection 2 of section 41, it talks about if person where they send message to another person where they use computer system, let's say use phone, use computer, use other gadgets there, where offensive, pornographic, that you get rudeness, you get mortal man in naked one, or indecent, or we get cause, or where they incite the other, or they cause, they threaten the person, we then call menace. You do that day without the consent of the person, or you know say what they do so na false thing, na lie they do, and a thing we get the tendency for endanger, make the person in life they in danger, or it cause harm, or it cause injury, or it cause intimidation, or it cause enmity, anxiety to them, where they depress them. Instead of an offense, we call them cyber bullying. The first one is cyber stalking. This one is cyber bullying, where they send messages, rude messages, they cause person, they send degrading messages, tell them something where they make they feel bad, they threaten them, where they scatter them. Like the computer system, say on a phone, online, they scatter them. Instead of an offense. Or he send messages that we know say a lie message against somebody. We know say they put the person in life in danger. Or they injure the person in reputation. That's an offense. Instead of they find you guilty, the court get right for sentence you a minimum of 30,000 new leons and a maximum of 50,000 new leons. So when they talk about this minimum and maximum, that means that they sentence, they fine you. After they don't find you guilty, the least way they fine you are 30,000 new leons, one are 30 million old leons. The maximum now 50,000 new leons or 50 million old leons. Then if you're not an individual, you're not one person. Now if you, like a business or a corporation, let's say in a mobile company or any other company, you do anything there, the least way that they find you, now 100,000 new leons, when 100 million. The maximum, now 250,000 new leons, or 200.